Hi Jeff, my name is Kristen and I'm a physical therapist. From the history you gave, it sounds like you may have a few things involved. The athletic trainer you saw is probably accurate in that you have a pectoralis major involvement, probably a partial tear, or you would have pretty significant weakness. And the fact that it's been so long since the initial injury, that partial tear has probably repaired itself. There's another component that could be involved, and that's the brachial plexus, which is a nerve bundle that comes out from the axilla right here in the armpit. So I'm going to address both issues. I think you've done the right thing with having some massage, because massage can really help lengthen the scar tissue and get the scar tissue to go in the direction of the muscle fibers. As far as weightlifting, I would really back off on the weight you're lifting. You had listed that you're lifting about 85 pounds. I would back off to 60 or so pounds and do the same exercises you've been doing, but with significantly less weight. I would go up slowly as long as you've been pain-free with that particular weight. Then you're allowing the muscle fibers to really regrow and build gradually, which will also help the scar tissue form in the direction of the muscle fibers. So you can do the same weightlifting routine that you were doing, but I would drop significantly in weight, do the same number of repetitions, and then increase that weight gradually and see how it does. The other thing is I would like you to do is strengthen the serratus anterior. I think you've probably done that as part of your routine at some point. It's pretty common. But we're going to just add one piece to flies or to the bench press. I'm going to show you it here on the treatment table. And so envision this being significant weight. You want to drop for a press, you're going to let your elbow drop down slightly, but again, no pain. You're going to push straight up, and then I want you to add this plus component. So this plus comes right from the shoulder and the thorax, and not just from the elbow here. So you're going to go through the full motion, and you're going to do a chest press plus to engage the serratus, and go through the full motion and plus. And you're going to do about 10 to 12 repetitions of that, and add that as part of your weight routine. And again, I would load the joint. If you're lifting 85 pounds, I would load the joint to being able to do maybe 50 to 60 and then gradually increase from there. The next thing is I want to address the brachial plexus. I'm going to give you just a general nerve glide that's going to help mobilize that whole nerve bundle gently. And it's important that you stay below the level of pain because you can really flare yourself up. So the exercise goes like this. You're going to start by looking at your hand, making a fist, and side bending towards the right arm. You mentioned that you have left impingement. This could help the left side too, so I'm going to have you do it on both sides. You're going to side bend towards the right. You're going to extend the arm and hand and tilt your head to the left at the same time. And about here, you're going to feel tension through the nerve bundle. So I'm going to have you go here and out. And as you feel tension, that's about as far as you're going to go. And you're going to glide about 20 times about this speed. And then you can begin to move the direction of the thumb up and down. But again, just as it all should feel tension and gliding, not pain. And then I would repeat it on the opposite side, where you're side bending and gliding away, side bending and gliding away. And what we're doing is trying to just calm that whole nerve bundle down that's right here up in the axilla. So I hope that answers your question, Jeff. If you Have any other questions, please feel free to contact us. Be well.